Hi, it is Lisa Blake at I Am Lisa Blake. Welcome back to Nursing You. This is the channel where we support nursing, we share information, and we give support and discuss all things nursing. So today I want to talk to you about what you do before you page the doc. So you're in a hospital setting and you have to page the doc. So what do you do? How do you prep for that? And then what does the conversation with the provider sound like? The first thing I want you to do is to think about the context of the patient visit. For example, Mr. Brown is a 72-year-old man. He was admitted with pneumonia on 6/2/22, and he has a history of diabetes and hypertension. The second thing I want you to think about is, why are you calling? Why are you concerned about this patient? You're concerned for a reason. So for example, if we're going with that pneumonia diagnosis as an example, you'll want to ask, or think about rather, what is going on with the patient right now as it relates to the diagnosis, and why is it important? So for example, I'm concerned, I'm calling you, Dr. Smith, because I'm concerned that the patient has had 2 breathing treatments showing no improvement in his breathing, and he's complaining of shortness of breath. The third thing I want you to think about is the vital signs. So the vital signs are important to include not just the respirations, but also the blood pressure, the pulse, and definitely the pulse oximetry. What are the vital signs, and are there any therapies running? For example, it could be that the fluids are running. The fluids may be running, and sorry, I messed up there. The fluids may be running, but what is our concern about why the patient may be short of breath in relationship to the fluids? Right, the patient may be fluid overloaded. So you'll want to include if they have any IVs running. You'll definitely want to include if they're on any oxygen. In addition to that, of course, you'll want to include your pulse oximetry, the last patient sat. The fourth thing I want you to think about as it relates to this patient, and by the way, if you're enjoying this content, I would like you to click the like, describe buttons, and subscribe to YouTube, share, and hit that notification bell for any future videos. I want you to stick around also because I have a little bit of a bonus at the end I'd like to share with you. So the fourth thing I want you to think about is labs. What are in this case, what are the patient's ABGs? What did the patient's last arterial blood gases show us about the patient's condition? This will make you feel prepared and add to your credibility when you're speaking to the provider. And that will save a lot of time on the back end as the clinicians and your colleagues begin to trust you, that you have integrity, that you're thoughtful, that you're prepared, and that you know what to focus on. Okay? Now for that bonus. At the end of the call, or before the end of the call, I want you to think about what the doctor might say to you. For example, say this was a call where you believe the patient may be going septic. At the end of the call, you would anticipate that they would order blood gases, that they would do blood cultures. Those are the type, maybe a UACNS, those are the type of orders that you would anticipate that the physician would order. Why is that important? It's important because you want to think about, what if they don't do those things? And what does it mean for the patient? And perhaps I'm in a position where I can advocate for the physician to think about these things. I hope you enjoyed the content. Please join me again at Nursing You. hit like, subscribe, and hit that notification bell. Thank you for joining. See you next time.